You are welcome, Dr. Judith. So we have to
you.
set it right now from the start. That's Judith, and that is Dr. Judith. You're welcome. Good to have you.
I could also be Dr. Judith. I don't really know. Well, I really like it. I'm gonna say JJ.
Oh,
right? He might say,
that's
he might say. But I like it. Remember, I said, like, I know that's right. That's my girl, JJ. You know what I mean? Like, yeah.
Doctor,
It's good to see you.
Thank
good to
you
see you.
so much. I'm
Welcome.
glad to be here.
Glad to have you, Lady in Pink, by the way.
Thank you so much.
So why is it very important that we celebrate World Oral Health Day, especially in the context of Nigeria?
Well, World Oral Health Day is just one day in a year, but the oral status, we need to consider it from time to time. And I'm so glad that the awareness of oral health is increasing, albeit gradual, but it is, because the mouth is the gateway to the body.
Right.
Everything goes into the mouth and everything comes out of the mouth. Through the mouth, you can identify a lot of problems. So sometimes your dentist may be the first person to identify a systemic condition and so many others. So it's very good to increase the awareness for people to know that the mouth is as much as important as every other part of the body, if not more important.
Well, during our intro, looking at the stats is very alarming.
Yes, it's quite alarming.
From a young age, people are already having dental issues, and as they go older, it becomes worse, and some even go untreated, undetected, or undiagnosed. Why is that?
Well, it still boils down to the level of awareness and how people take their oral status. So once you consider your oral health as important, then we'll attend to it. And I believe that these avenues are what is creating that awareness. We hope to have more of this so that people get more dentally aware of their teeth.
Before I get to the anatomy of the situation, I wanted to talk about the theme for this year: healthy mouth, healthy mind. So if you could please give some context to that as well.
The link between the two. How can a healthy mouth give us a healthy mind? I know some people who think it's exchanging lip fluid with other.
Well,
that's a dirty mind.
I finally got it. There you go.
So a healthy mouth, a healthy mind. You see, the mouth is, like I said, it's an access. We're talking now. I'm relating to you, my confidence, my self-confidence, and so many other things. Now, let's first start with the confidence. If you have a poor oral status, I wouldn't be able to smile. I wouldn't be confident enough to talk to you, which is also a thing of the mind.
Right.
Yeah.
Now, let's talk about your health. You have a toothache, for instance.
Right.
You wouldn't be able to do anything. You wouldn't be able to think. You wouldn't be able to reason and all of that. So the self-esteem, also is affected by bad oral status. So a healthy mouth is actually a healthy mind.
That's very
healthy
interesting.
mouth, healthy mind.
Yeah.
You brought some gentlemen here with us.
I was going to make a reference.
I'm so excited to play with these people.
It's a puppet to me.
Yeah,
I know it's much more important, but
what do you call the thing? Ventriloquist. This guy has an overbite, doesn't he?
So yes, so doctor, explain to us the details here. What we're seeing. I'm hoping that our cameras can zoom in on some of.
No, I think I can zoom in on mine. See?
Yeah. So
do it, guys. Come on.
The structure of the mouth here. Oh, by the way, a healthy mouth isn't limited to the structures inside of the mouth.
No.
I'm going to get to talking about all of that since it's an access to the entire body, while Judith is having fun with our set of teeth here. But explain to us why we have so many different characteristics to the teeth that we see inside of this prop here.
Okay, so
Judith, hand it back.
No.
So this is a pathology model. It shows the progression of cavities and some other oral problems in the mouth. And I always like to use this because you describe...
You can hold it up to your camera so that we can zoom in. That's your camera over there.
Okay.
Yes, so hold it up while you're talking so that we can see how much of it we can capture.
Yes, so we're talking about cavities here. So this is basically progressive dental cavities, how they start. So dental cavities start as a very tiny dot. We have something like this here, which is just limited to the substance of the tooth. So the tooth has different layers: the enamel, the dentine, and the pulp. So cavities move. You have organisms in the mouth. The organisms dwell on the teeth. They feed on the food. They release acids, and the acids destroy the teeth. they stay in the pocket of the teeth, they eat more food, they release the acid, and then the acid continues to destroy the teeth, and the cavities get bigger and bigger. So initially, one has a tiny cavity, doesn't even know that he has a cavity. Now, as this acid starts to destroy the tooth, the cavity gets bigger and bigger. Now, as it's getting bigger, it's moving from one place to the other. So it's moving from the enamel to the dentine. Once it's getting into the dentine, you start to have sensitivity. Oh, my tooth is shocking. I feel shock when I take cold water. I feel shock when I take hot water. But after a few minutes, it's off. And then if it's not treated, it goes into the pulp. So you can see the progression from the enamel to the dentine to the pulp. So we have this one within the enamel and dentine. Now you can see that it's gotten into the pulp and it's all the way down to the root. By then, such people start to have pain that is excruciating, pain that disturbs your sleep at night. Pain that comes up on its own when you're doing anything. It just, it's spontaneous.
I once had a period. I couldn't sleep for 2 or 3 days.
Oh yes, you could have,
because of a certain pain I was getting from. I think I took it out eventually. I never replaced it, but it was terrible.
You should replace your missing tooth.
We'll talk about that.
Yes, and then if you don't still attend to it, sometimes the pain, some people can't tolerate so much pain, it goes away, but the infection is still there. One thing with a tooth problem is you don't leave it. Your herbs or whatever you take can never solve a tooth problem. It's only the dentist, and you have to either take out the problem or take out the tooth. But as long as the problem is there, it still remains there, and it will get worse. It will flare up.
Before you touch on any other subject, there is a certain substance. I don't know if you have seen the substance, if you've heard about it. It's called touch and go.
All right.
Touch and go. I see. You know what I'm talking about. I don't know what it is, but it's a liquid, and they say if you have a toothache, you just simply put it on there, and quite frankly, it works.
But how come you always come back to the dentist? If it works, then why?
She really is a Judith. You really are a Judith.
So while I'm not espousing to its use, I'm saying that what exactly is that chemical, and how bad is it?
Well, I know it contains a bit of aspirin or something, but the truth of the matter is that they don't really work. These are organisms. You can't touch and go. There is nothing like touching and going. The organism is not going to go anywhere unless you take it out. You take it out and you cover that cavity. In as much as you have a cavity there, those organisms will keep thriving.
Okay.
So all those substances, the touch and goes and all of that, yeah, they may give you momentary reliefs, but the truth is that the organism is still multiplying in troves. And they would eventually overwhelm the system because infection would spread. It will spread from within the tooth to the outside of the tooth in the bone. You can see these areas, right? You can see that the infection has already gotten to the roots of the tooth and is spreading in the bone. And sometimes, it could gather a lot of pus, swelling, and track to the neck, to the head and so many spaces. So tooth problems shouldn't be taken lightly.
Okay, but in a bad situation, you can just simply take all of it out, like I did when I was 26, I think. My first tooth extraction was just that. Take it out. Let's just get rid of the problem. Now I hate dentists because he never gave me an option, this man. I know your office. But I also hear, and you said that here, that taking out my teeth requires that I put back an artificial one. I do have one artificial tooth. But why is it important that I replace it?
Also, some teeth, when they have problems, can be treated. Now, the only teeth that cannot be really saved are teeth that are badly destroyed. So you've waited for that cavity, the cavity has gone, so bad, and when you treat it, there is really no substance left, so there is nothing to build on. Such instances, you need to take out the tooth. You also have the last teeth in the mouth, which we call the wisdom tooth, the third molars. Sometimes they don't erupt in the normal way, just like you were asking earlier, like some of them impacted. So you see that all your other teeth are standing upright, but because you don't have enough space for the last tooth to come out when it's about to come out, it's inclined in a way that it could start affecting, the other teeth or the other tooth in front of it. So because of that, you may be asked to take them out. But any other teeth apart from the wisdom tooth, once you take it out, it's always advisable to replace them.
Wow.
Why? When you take out a tooth, for instance, you have a space there. Nature does not like space. Your teeth are always in contact with each other.
The force is always thick.
Yeah, side by side, and then when you touch. So that is how the body has designed those teeth. So they are comfortable, you know, when they touch each other. Now, when you take out that tooth now, there is now going to be drifting of this tooth in the bid to look for that contact. The teeth on either side of that place would
lean into each
will
other.
be leaning to each. It's going to drift. That's not only that. Now, when you bite together, your upper touches the lower. Once this lower is missing, this starts to over-erupt in the bid to look for that contact. And once that happens, it's going to erupt to be longer than the other teeth, which has already distorted the normal anatomy of your mouth, the arch. So because of that, you may now start having problems here because the roots are exposed. The ones that are drifted has altered the anatomy, and before you know it, you may start having problems with those teeth, which would eventually lead you to taking them out as well.
All right. Let's talk about some fads in the pursuit of clean teeth or white teeth. I feel like white teeth is a myth, really. You know, were you born with white teeth? So there's a situation where I think went viral on Twitter when people were talking about whitening the teeth and the pain that comes with it, right? So let's talk about that, this fad of clean dental dentation, scaling and polishing, whitening, and also veneers.
Okay.
What is the appropriate thing, or what is accepted best practices in the dentistry world regarding those three?
Okay, so first and foremost, I would say that teeth color matters. Or teeth, I'll use the word color to color your teeth.
It's not white,
but, yes, but at the same time, you know, we are in the world where everybody wants
perfect smile,
white teeth, celebrity teeth, paper white. Paper white teeth are seen in children. Milk teeth. The adult teeth don't really appear to be paper white, you know, too good to be true white. Okay, but that is where we are going. That is where, you know, everybody's tending to. Everybody wants white teeth and all of that. The adult teeth has a gentle, slightly off-white hue, and there's a reason for that. You have the enamel, you have the dentine, you have the pulp. Enamel is the one that totally covers. Then the dentine is darker in color, so you see the reflection of the dentine under the enamel. Now, when you although we also have people that have tooth anomalies, hypoplasias, and all of that. So tetracycline stain. So you could have people with their teeth very brown, which are unnaturally brown.
But they're healthy.
That is self-esteem. Some are healthy, some are not healthy. But it's self-esteem.
Yeah, that affects your mind.
Yes.
Imagine.
And we're just talking about the healthy mind. So for such people, they wouldn't be able to smile. They wouldn't be able to, you know, to talk and all of that. So that is where the intervention comes in. On the other hand, we have the process of teeth whitening now where you can, so let's start with the stages of darkened teeth and how to go about it. The first thing is most of the discolorations you have can come from your debris, your plaque, your calculus on your teeth stains, smoking.
Yeah, your coffee stains.
Your coffee stains. They cause darkening of the teeth. So once you come to the dentist, the first thing they will do is assess your teeth. Most times, by the time you just do a routine scaling and polishing, it takes off your stains and your teeth are okay. However, you have those other stains that go a step further, which are the intrinsic stains. You see those stains, there are different stages. You can start with bleaching. Bleaching done by a professional is ideal because he knows the procedure, he knows the process, he knows the pros and cons. But you see everybody doing teeth whitening now. Everywhere you go to, we do teeth whitening.
So this fad of teeth whitening, and you go to an esthetician place to get your facial, like, oh, do you want to whiten your teeth?
Exactly.
Is this safe?
Exactly, that's what I'm saying.
Well, so I would just say a professional, you want to have your teeth whitening done, you go to a professional because they would assess you. They would assess whether you need a teeth whitening or not. It's not everybody that is a candidate for teeth whitening. That's the truth. Some people, the discoloration is so much that teeth whitening may not be able to solve your problem. That's where we now go to other procedures like the veneers and the crowns. You actually do them when there is need. But you know, veneers now, it's a cosmetic thing. Teeth whitening is cosmetic. And there are times you do teeth. you don't whiten your teeth. We even have over-the-counter teeth whitening agents.
Yeah. So,
People just abuse those things, and then eventually it causes a lot of problems because they've literally destroyed the tooth, so they are exposed to a lot of sensitivity and problems.
on the subject of it being a healthy mind, teeth whitening actually isn't for everybody, like Dr. Judith said, because somebody gave me very interesting advice once, because I wanted to whiten my teeth. I've got pearls, but I wanted it to be white, and he looked at my eyes and he said, no, it's not for you.
Exactly.
And I said, why? Would you want to tell her? Tell her why exactly.
Because most times the color of the teeth matches the color of the white of your eyes.
So whitening your teeth.
No wonder my teeth is white. It's too long enough.
So
a
good dentist would advise you.
I got a good dentist that advised me not to
and
do
even if you're going to do teeth whitening, maybe just once every 4 to 6 months, they wouldn't keep on, doing it back to back. But everybody's doing teeth whitening.
When does one need scaling and polishing then?
every time.
You need to have scaling and polishing.
And who is qualified, if that the term is, for scaling and polishing?
So you need to have scaling and polishing every 6 months. I will talk about that. Okay?
I'm sure.
Because of gums. So we've talked about cavities. That is problem on the tooth. We also have problems with the gums. And if you don't attend to that too, you will lose your tooth. Even though you don't have cavities, your tooth will eventually start shaking and it will fall off on its own. And when an adult tooth falls off, it can be replaced. It won't grow back. A baby tooth would be replaced by an adult tooth. But an adult tooth, once it falls off, will not grow back. Now, when you look at your normal smile, you look at the margins of your gums, right?
Yeah.
You notice that they are tiny. You have these very little pockets in, just like your nail bed. You have those pockets in. And no matter how you brush your teeth, those pockets cannot be taken care of by your brush. Now, they harbor organisms, food debris, and all of that too. But they harbor them in tiny quantities. There is a certain period of time where they've accumulated enough to want to start causing problems for you, like bleeding gums, mobile teeth. Once you have bleeding gums, your gums are not healthy. And one of the only solutions is once you just do your scaling and polishing,
that takes care of
the bleeding gum is taken care of. So we always say that for those organisms to want to start causing those problems, it takes about 6 months. So routinely, you have your scaling and polishing done every 6 months. So you have those specialized instrument that goes into those crevices and the gums and takes out those debris.
So we can't get the
plaque.
same effect with our brush.
Not at all, you can't.
So why we have to brush every day now?
You brush every day because
Imagine
of
all the time I
tooth.
could have saved not brushing.
No, you still
Weirdo.
have, you still have to brush.
I'm joking, doctor.
So you still have to brush, okay?
Yeah, I mean, twice a day for me, morning and evening, and then, I remember I was telling somebody, and then the person goes, oh, but you're going to get bloody gums. What are bloody gums?
You get bloody gums if you have gingivitis, which is gum issues.
You hear that?
And gum issues come from not brushing your teeth regularly, not seeing your dentist regularly, and not brushing properly.
How frequently should we be seeing our dentist?
Every 6 months.
Every 6 months?
Twice a year.
Before you go, I wanted to also touch on the fact that while we have focused plenty on our dentition and the mouth, real quick, there are other ailments that we can identify from, the mouth as well. And that might not be related immediately to our cavity, so our oral cavity. What are these diseases and what do they point to? If you can summarize for us some of these, how we can identify these diseases.
There are quite a lot of them, but I'll just mention a couple of them, like HIV.
Really?
Yes.
You can identify it from?
So there are manifestations, there are oral manifestations of so many conditions, even diabetes. There are oral manifestations of so many conditions in the mouth. So you could just routinely walk in to see the dentist, and then they take a look into your mouth and they're like,
maybe you should
we would like you to have this test done. So many of them.
I hear of a condition where it's actually a good smell. It's a fruity smell, but it points to perhaps, I don't know if it's liver or...
Why is your teeth smelling fruity?
No, it's not your teeth. It's coming from the inside.
It's coming from your breath. Yes.
Oh, sorry.
It's coming from your breath.
Shows how often should we change our toothbrushes? Should we floss before brushing or after brushing? Mouthwash, all the perks, all right.
So let's talk about your brushing first. Okay. Your brushing, a lot of us go that way.
Yes, I still go that way.
That's wrong.
Hey, look, it's still there. It's still there, doctor. It's still there.
Yes.
She really is a Judith.
The only thing you learned today, then I will be glad.
I've still got 30.
Yes, so when you're brushing, it's good to brush away from your gums. Because your gums are soft, your teeth are hard. When you brush this way, you're using the same force, and at the same time, it's going to cause gum issues. Your gums are going to recede. And when your gum recedes, it's going to expose your roots. And when it exposes your roots, you're going to have sensitivity and more dental problems. So when you're brushing, you brush away from your gums and into your mouth. Okay? So it's not like this. And it's not like this. So when you're brushing, you brush, away from your mouth, away from your gums, into your mouth, okay? It takes a little longer time, but you notice that the bristles are massaging your gums.
Okay.
They are also going, all those spaces in between your teeth to scoop out whatever you have in there, at the same time. And you do it in, and you do it, in the mouth, up and down at the same time, okay? So that's how to brush your teeth. And when you finish brushing, you remember that if you look at the teeth, here is sharp, but here is flat. That means that this is an extra surface for you to wash. So you also remember to take care of those surfaces as well. And then don't forget the tongue
as well.
And the back of the teeth. Yes, if you can, you should get your brush to the back of the teeth. Now, some people's mouth opening are quite small, so we always advocate a brush with a smaller head.
Okay.
That way, it will be able to get all the way to the back of the teeth, because a lot of people will brush their teeth and then at the back there, you have. So that's that.
Right.
Now, your toothbrush should be the medium bristles.
Medium?
Yes.
I like it hard.
No. So,
Oh, Judith.
hard,
Oh,
yeah,
Judith,
I'm pushing
Judith.
some tables today, right?
Both Judiths, you guys need to clean your mind.
So hard
It's a
brushing.
news show.
Please.
Yes.
Say anything.
Dr. Judith.
Yeah.
Don't mind. Keep going, JJ. Don't mind
Yeah. So
him.
you use a medium bristle toothbrush for adults and for children, soft. If you use a hard one, I talked about the enamel. Enamel is the hardest substance of the body, protects the other part of the tooth. Once your enamel is exposed, tooth becomes sensitive because the dentin is exposed, and anything you put in your mouth, you react to it, or it gives you that shocking, very uncomfortable feeling. And once you use a hard brush, it's going to wear down the enamel. Once you wear down the enamel, the tooth becomes yellower because the dentin is darker and is
So
exposed.
soft for children, medium for adults,
Medium
hard.
for adults.
Nicole.
Kosi hard.
But we're-
Hard Kosi.
So I smoked for a long time, and I was advised to use hard bristles, so I've stuck to hard bristles.
No, it's not advisable to use hard brush.
Oh, not even as a smoker?
No?
Or a former smoker?
No. What about automatic toothbrushes? Are those good as well?
Oh, yes, they're good. They're good.
Because I mean, with the speed.
Yes, the electric toothbrushes.
Yeah.
Yes, studies have shown that they do better.
All right.
They do better than even your manual brushing.
So, yeah, okay. And then what about flossing and mouthwash? Should mouthwash replace flossing?
Alcohol or no alcohol?
Okay, so
The alcohol.
Don't do it.
No, the alcohol. What I mean is alcohol mouthwash. That's what I'm referring to.
Mazzino,
Should you or shouldn't you?
don't, okay.
It's a good
Go
question.
ahead, go ahead.
So let's talk about mouthwashes.
Okay.
We have a lot of mouthwashes over the counter, and there are different mouthwashes for different uses. So you don't just walk in and pick any mouthwash. The routine mouthwash are the ones that contain fluoride.
Okay.
So any mouthwash that contains fluoride, so you check it, once it contains fluoride, it's good for you.
Okay.
Other medicated mouthwashes are prescription drugs. They are actually drugs, and you shouldn't use them for a long time, because just like you don't use antibiotics for a long time, you also don't use these prescription mouthwashes for a very long time.
Okay.
So if you're going to be using over-the-counter mouthwashes, just go for the ones that have fluoride. You have the alcohol-based, you have the ones that are not alcohol-based. Anyone, depending on your preference, it's okay. Some are more harsh than the other, but of course, that's up to you to decide.
I like the
As
harsh
long
ones,
as-
the ones you can use to clean your toilet. That's the kind
Toilet, mouth.
Give me a
That's
And
scary.
people keep sending me down this road.
I like
my brain is
I like
just
to kill
filled with
everything.
it.
If you can kill the germs in the bathroom.
Well, so like I said, the antibiotic mouthwashes kill germs, or they bring down the concentration of the germs. So I don't like to use the word germs. Let's use the word microorganisms.
Okay.
As we're talking, we have microorganisms everywhere, on your skin, in the air,
We have useful ones in
and you
our
have them in
mouths.
the mouth. They are useful until they overwhelm the mouth. So when they become so much, they start to cause problems for you. So you need to keep them in check. And all the things we talked about, the flossing, floss after every meal is very important. You're brushing twice a day, your regular dental checkups. Now, if you see a dentist regularly, before your cavities even become visible to you, your dentist has seen it. And it's not every cavity your dentist will take a drill and, you know, fill it. And
Right.
sometimes they just prescribe 1 or 2 things for you. You use it, and then the cavity gets arrested.
Judith was talking about floss.
Yeah,
Flossing.
Yes.
flossing.
So flossing-
There's this viral video on Instagram, and I want you to also talk about that. I was talking about flossing. People who give unsolicited advice about, you know, dental care, and you'll be like, oh, before you brush, you must scrape your tongue. There's that part. People are now doing all of this whole routine of flossing first, and then mouthwash, and then brush, and then tongue scraper.
There is no routine to oral care. There is no this before the other and that before the other. You brush twice a day. You floss after your meals. You see your dentist regularly.
But no toothpicks.
You use a fluoride toothpaste, a fluoride-containing toothpaste.
What about toothpicks?
Toothpicks, no. Okay. Now, what toothpicks do? Toothpicks are very wide. They are wider than the spaces in your gums. So once you push a toothpick, you are traumatizing the gums. And the gums are very specialized tissues. They don't really like too much of trauma and prodding. So you can see that the dental floss will just, you know, slide in and slide out with no issues. But when you keep putting your toothpick, what it does is that the gums there recede. The bone, we call it interdental bone. So your teeth are buried in bone. So what you're seeing here, there is like 2/3 of it buried in bone. Now
the pyramids. Sorry, my brain. It just came up. Keep going.
All right. So when you keep using a toothpick, you destroy that interdental bone in between. Then you now start having pockets in between. And then when you have pockets, you have more food packing, you have more germs, and you have more dental problems.
Wow.
So toothpicking, it's not encouraged. Dental floss is the ideal. Yes.
Dr. Judith and Judith.
There we go.
Dr. Judith, thank you very much for the detailed instructions that you're giving us today on. Oh,
Sorry.
Somebody very interesting is
tongue
asking us.
scrapers.
Yeah.
Would you advise that we use that consistently, or?
No, tongue scrapers, yeah. People, you can use tongue scrapers. I don't really use tongue scrapers. Just using your toothbrush to brush your tongue is fine. But some people, you know, psychologically too, they feel more comfortable using tongue to be sure. But it's all good.
I wonder if the marketing of our toothpaste was a reason. I wonder if the marketing for our toothpaste, whether in the 90s or the 80s or even now, is a reason why we're obsessed with white teeth.
I can't really say about that.
Bright smiles, white teeth.
Can't really.
Oh, remember those ad in the 90s where the guy was smiling and waving at the plane, and his teeth was glimmering? Yeah, always comes to mind every time.
Your age is showing. In any case, Dr. Judith Jolayemi, thank you very much.
You're welcome.
We've had a very interesting time here. Thank you for bringing the props so we can get a very interesting insight into exactly the anatomy of the mouth and how these ailments or diseases actually take root. In every sense of the word, take root. Thank you very much once again. And we'll be looking forward to bringing you on to talk more when we have issues regarding our oral, our mouths and everything oral. Thank you.
And also thank you to Mr. Rugged and Mr. Smooth for coming on. They the dental teeth on the phone.
Oh, those guys.
I've given them name. Those guys.
Oh!
Yeah. Oh, you didn't know I was talking about them?
All 5 of us. Thank you once again, Doctor.
Oh, goodness.
Thank you
Stick
so
around.
much.
Coming up
Thanks
next
for
is going to be...